Good morning, dear students. Topic of today's lecture is the circulatory shock. At the end of my lecture, you should able to answer the following. Define circulatory shock, sign and symptoms of shock, classify shock, describe hemorrhagic shock, cardiac shock, obstructive shock and the distributive shock. Circulatory shock. Circulatory shock, or simply called as shock, it is a life-threatening condition. It is characterized by serious reduction of tissue perfusion with a relatively or absolutely inadequate cardiac output. In other words, the shock is a condition characterized by inadequate delivery of oxygen and nutrients to the critical organs such as heart, brain, liver, kidney, and the gastrointestinal tract. This results in tissue hypoxia and cellular dysfunction. Now, the cardinal features in all shock is the low cardiac output. Occasionally, cardiac output is normal or even greater than normal, yet the person is in the state of circulatory shock. This situation can result from excessive metabolic rate, as in septic shock, so even a normal cardiac output is inadequate, or abnormal tissue perfusion patterns, so most of the cardiac output is passing through the blood vessels beside those that supply the local tissue with nutrition. Why should we take care? Because with the shock there is the high mortality rate. It is 20 to 90%. In early stage, when the O2 deprivation is less, then this stage is reversible. Early intervention reduces the mortality. That's why we have to take care, and within the early stages of the shock, we should treat the shock. If the shock it reaches to the last stage, it led to the death of the patient. When we talk about the sign and symptoms of the patient with shock, is skin is cold and clumsy skin, cyanotic tints of the skin, increased sweating, pulse rapid and thready, respiration shallow and hurried, blood pressure is decreased, tongue is dry, eyes are shrunken, muscle tone reduces, weakness extreme degree, restlessness and apprehensions, thirsty, urine output decreases, that is known as the oliguria, no visible bleeding. So these are the signs and symptoms of the shock in common. Now, what are the different causes of the shock? Mostly the cause of the shock are severe bleeding, severe burn, heart failure, heart attack, head or spinal injury, severe allergic reaction, dehydration, electrocutions, serious infections, extreme emotional reaction. These are all the causes of the shock. Now, when we talk about the types of the shocks are cardiogenic, hypovolumic, obstructive, distributive. In cardiogenic, there is some defect in the heart itself. Hypovolumic shock, in hypovolumic shock, the distribution of the blood is affected, and it is the inadequate blood supply to the different organs. Obstructive, Shock, in the obstructive shock, there is the obstruction to the flow of the blood, so that it does not reaches to the, and it does not supply to the other part of our body. Distributive shock is there. So in this there is the septicemia occur, or it is the neurological in the time. When we talk about the cardiogenic shock, they are because of the myocardial damage, myocardial infarction, sustained arrhythmia, ventricular heart diseases. Hypovolemic shock. This hypovolemic shock, it is the most common type of the shock, and this they are divided into the different type of the shock: hemorrhagic shock, traumatic shock, surgical shock, or the dehydration shock. Obstructive shock, pulmonary embolism, cardiac tamponade, tension pneumothorax. Distributive shock, it is loss of sympathetic vasomotor tone, that is known as the neurogenic shock. Anaphylactic shock, because of the vasodilator, inflammatory mediator, septic shocks. So there are the 4 type of the shock, and according to the sign and symptom they are divided into the different type. Hypovolemic shock. Hypovolemic shock is also known as the cold shock, as it is caused by the low blood volume resulting in the decreased cardiac output. In hypovolemic shock, there is the decreased level of consciousness, increased thirst, restlessness, dilated pupil, release of ADH is there, increase in the heart rate, increase in the respiratory rate, and this respiration, it is the rapid and the shallow breathing is there. Hypotension is there, decreased pulse pressure, the pulse is rapid and the thready pulse is there. There is the release of aldosterone and cortisol, decreased urinary output, increased specific gravity. And there is a cool, clumsy, bluish or grey color skin. Decreased capillary refill is there. Constriction of the splanchnic vessels that causes the nausea, abdominal pain. So this depending on the causes, the hypovolemic shock may be of the following type: hemorrhagic shock, dehydration shock, traumatic shock, surgical shock, burn shock. Hemorrhagic shock occurs as a result of external or internal blood loss, which is caused by the ruptured blood vessels. And this hemorrhagic shock, it is the most common type of the hypovolemic shock. According to American College of Surgeons, hemorrhagic shocks are of the divided into the 4 classes according to the degree of the blood volume lost. Values are based on a 70 kg adult. So in class 1, the initial stage of the hemorrhage, the blood loss is up to the 750 ml or the 15% of the total blood loss. Class 2, blood loss between 750 and 1500 ml up to the 15 to 30% of the total blood volume. A non-progressive stage in which the normal circulatory compensatory mechanism eventually causes full recovery without help from outside therapy. Class 3rd hemorrhage, progressive stage. The blood loss is between 30 to 40% of total blood volume, that is the 1500 to 2000 ml. Without therapy, shock become steadily worsen until death occurs. And severe class 4 hemorrhage the blood loss is more than the 40%, about more than the 2000 ml or more. The shock has progressed to irreversible stage and all forms of known therapy are inadequate to save the person's life. Dehydration shock. Fluid loss when insufficient amount can dehydrate the body and reduce the circulating blood volume. Some of the causes of this type of shocks are excessive sweating, fluid loss in severe diarrhea or vomiting, excess loss of fluid by the kidney as in diabetes insipidus, inadequate intake of the fluids and electrolytes, destruction of adrenal cortex with loss of aldosterone secretion. Traumatic shock. It is a special type of the hypovolemic shock in which there is associated neurological shock caused by severe pain which inhibit the vasomotor center. And this traumatic shock mostly occurs due to the damage of the muscles and the bone, which is very common in the battlefields and the road accident. Extensive contusion of the body can damage the capillaries sufficiently to allow excessive loss of the plasma into the tissue. Traumatic shock mainly from the hypovolemia and moderate degree of neurogenic shock. Then we come to the surgical shock. Surgical shock developed during or after surgical procedure. Causes of surgical shock is internal hemorrhages, external hemorrhages, dehydration. Then the burn shock. Shock produced by the effect of the burn. If skin is burned, there occur the exudative lesions and sweating. In burn, large part of skin get denuded and large amount of plasma is exuded through the exposed part. So, there occur the decrease in the extracellular fluid volume, loss of the plasma more than loss of the whole blood from the burn surface, which result in the concentrations. Sluggish blood flow which decreases the cerebral blood flow causing the shock. Or we said that burn shock it is due to the hypovolemia due to the plasma loss is due to the more of the plasma loss, which is the most common complication of the severe burn. Then we come to the distributive shock. Distributive shock, also known as the low resistance shock or the vasogenic shock. Low resistance shock occurs when neural reflexes or toxic substances causes excessive vasodilatation within the vascular system. Blood volume is normal but inadequate blood supply to the tissue due to increased vascular capacity. Capacity of vascular system increases by extensive dilatation of the blood vessel. Due to vasodilatation, the size of capacitance vessels is increased and thus the cardiac output is decreased in spite of the normal blood volume. Low resistance shock is also known as the warm shock because the skin is warm. Depending on the causes, the low resistance shock or vasogenic shock is divided into the following type. First is the neurogenic shock, anaphylactic shock, septic shock. Neurogenic shock. Sudden loss of vasomotor tone throughout the body resulting especially in massive dilatation of veins, which led to decreased cerebral blood flow and the syncope. Syncope is a transient, self-limited loss of consciousness due to acute global impairment of the cerebral blood flow. Causes of neurogenic shock include blood trauma that result in the depression of vasomotor center, spinal cord injury, high spinal anesthesia, and drug overdoses. The causes of syncope can be divided into three categories: neurally mediated syncope, orthostatic hypotension, and the cardiac syncope. Neurally mediated syncope further divided into the vasovagal and the situational reflex. Vasovagal syncope is a provoked fear, pain, anxiety, intense emotion, sight of the blood, unpleasant sight, and the odor. While the situational reflex syncope is the cough, micturition, cardiac sinuses, deglutination, etc. Then the other type of the syncope is the orthostatic hypotension, defined as a reduction in systolic blood pressure of at least 20 mmHg or diastolic blood pressure of at least 10 mmHg within the 3 minutes of studying. In many cases, there is no compensatory increase in heart rate despite hypotension due to baroreceptor reflex dysfunction. Third type of syncope is the cardiac syncope. That is because of the arrhythmia, heart blocks, etc. Anaphylactic shock. The anaphylactic shock refers to an acute allergic reaction. Large quantities of the histamine and histamine-like substance released in allergic reaction causes vasodilatation and the venodilatation. Vasodilatation of arteries, it greatly reduces the blood pressure or the peripheral resistance. Venodilatation, marked decrease in venous return, greatly increase in the capillary permeability, rapid loss of the fluid and protein into the tissue space. Septic shock. Septicemia is a condition in which bacteria circulate and multiply in blood and form the toxic product and causes the high fever. Most cases of septic shock are caused by gram-positive bacteria followed by endotoxin producing the gram-negative bacteria. Now the features of septic shock is the high fever, vasodilatation throughout the body, especially in the infected tissue. Initially high cardiac output in perhaps half of the patient caused by the high metabolic rate and body temperature resulting from bacterial toxin later led to the myocardial depression. Sludging of the blood caused by the red cell agglutination in response to degenerating tissues. Development of microblood clots in widespread area of the body, a condition called the DIC or the disseminated intravascular coagulation. Loss of the plasma into the infected tissue through the deteriorating blood capillary walls. Mainly this septicemia occur in the condition like the acute peritonitis, perforation of the bowels, strangulated bowel, and the different type of the sepsis. Now the obstructive shock. Obstructive shock, or more precise to be extracardiac obstructive shock, occur due to impairment of ventricular filling during the diastole due to some external pressure on the heart. When the heart is prevented from pumping because of the mechanical obstruction to the blood flow. So, due to decreased ventricular filling, the stroke volume and hence the cardiac output is decreased, causing the circulatory shock. Causes of obstructive effusion shocks are pulmonary embolism, result in elevated right-sided heart pressure but left-sided pressure remain normal or low. Cardiac tamponade, which result from an accumulation of the fluid in pericardial sac, causes elevation of pressure on both the right side and the left side of the heart. A tension pneumothorax develops when the air in the pleural space began to exert positive pressure on the mediasternal structure, including the heart, which compromise left ventricular filling. Cardiogenic shock occur primarily as a result of severe dysfunction of the left, right, or both ventricle that result in inadequate cardiac pumping. The most common cause of cardiac shock is myocardial infarction, resulting in a significant dysfunction or loss of greater than 40% of left ventricular myocardium. Greater than 40% loss of the blood or the dysfunction of the left ventricular myocardium. When we see all the types of the shock or different types of the shock, hypovolemic shock, cardiogenic shock, extracardiac obstructive shock, or distributive shock. In the hypovolemic shock, there is the reduced cardiac preload and reduced ventricular filling during the diastole. This led to the decreased stroke volume, decrease in cardiac output, severe reduction in tissue and organ blood flow, failure of multi-organ system. Cardiogenic shock, reduced systolic performance, decreased stroke volume, decreased cardiac output, severe reduction in tissue and organ blood flow, failure of the multi-organ system. Extracardiac obstructive shock, reduced ventricular filling during the diastole. This led to the decreased stroke volume, decrease in cardiac output, severe reduction in tissue and organ blood flow, failure of the multi-organ system. Distributive shock, there occur the marked fall in peripheral resistance, severe depression of myocardium that led to the severe reduction in the tissue and organ blood flow, and this led to the failure of multi-organ system. While marked fall in peripheral resistance, alteration in the distribution of blood flow in the microcirculation led to the failure of multi-organ system. So these are all the types of the shock. So this is all for today's lecture. Thank you.